Hello everyone, this is my informational presentation on how to navigate your child or loved one's diagnosis with pediatric neuroblastoma. This is going to be focused on providing guidance to parents or caregivers who have an infant that has recently been diagnosed and are seeking help when it comes to navigating this unexpected event. Alright, so now this is going to be everything that we are going to run through today. So first of all, what exactly is neuroblastoma? All of the symptoms and causes, who it affects, and more will be within that section. A quick message that I just want to give caregivers from myself. And then we will go into a treatment plan with a fake patient so we can get through all the steps as realistically as possible of what is recommended that you do in general. So we will go over the history, diagnosis, treatment, and then monitoring. Alright, so before we get into the very serious realities of this disease, I would like to first introduce myself. So my name is Audrey Anthony. I'm currently a high school senior and aspiring physician's assistant. I have many connections within the medical field as I currently work in many medical settings for pay and for volunteering. I have consulted many medical professionals to ensure accuracy of this presentation, and although everyone takes different approaches towards treatments, and obviously your treatment plan is going to be very different from the one that I show you because they're supposed to be personalized based off of many different factors. This treatment plan has been approved by a pediatrician and a nurse who have many years of experience in their respective fields. So again, this is for a fake patient. It's just take it as a general, just as a little guidance, and hopefully it clarifies some things that your pediatrician may have told you or your doctors may have told you. Just take it as clarification, general route, but really try to reach out to your pediatrician and your doctors and have that communication with them to establish a personalized treatment plan for you and your child. Alright, so what exactly is neuroblastoma? So neuroblastoma is a type of cancer that mainly affects the age demographic of 10 years old or younger. The term neuro refers to the nerves, while blastoma refers to a cancer that starts in immature or developing cells, hence why this cancer is really only ever seen in children and infants. So this is the most common cancer found in infants, but it is also very rare to get this cancer, even though it is the most common in infants. So infants are classified as children who are under 1 year old. There are about 700 to 800 new cases in the U.S. annually, and this number has stayed constant for a number of years now. The average age a child will be diagnosed is about ages 1 to 2, and it is rarely found before birth, but it is extremely rare to find in children over 10 years old. The recovery rate for children who have lower or intermediate risk factors is about 90 to 95%, and older kids with higher risk have about 60%. Now, I just want to re-emphasize that survival rate. That high of a survival rate is something to be hopeful for, though it is the most common pediatric cancer, but it is also very rare to get. It is very highly curable. You and your child can make it through this, and just make sure you follow all of the steps that I go through in this video, as well as just constantly be communicating with your pediatrician or trusted doctor so that you guys can establish what those specific steps are going to look like for you. Okay, so first off, it is important to understand that there are 3 different types of tumors once they mature. So normally they resolve by themselves in these pediatric neuroblastoma tumors, but sometimes they can mature and become those high-risk tumors, which I will give an example of later on. But it's important to understand these 3 different types. So first is the most benign type, meaning that it is not deadly. And then this one is called a ganglion neuroma. It can advance into an intermediate malignant tumor called a ganglion neuroblastoma, or the most malignant is called a neuroblastoma. And why those have the effects they do is because of their structural makeup, which we won't get into, but comment below if you would like me to explain more of the tumor structure and their makeup. Okay, so now for symptoms. So they're going to differ based on the location of the tumor. So if the tumor is in the abdomen or pelvis, they may experience symptoms of loss in appetite, which will also in turn lead to weight loss. It could also be a large swelling in the child's abdomen. And also note that this lump is not normally painful to the touch in infants, one, because they aren't really able to express pain or discomfort, so you're not going to be be able to tell by their reaction, but in older children, they may be able to express that pain or discomfort. It is also possible that the tumor is pressing against the blood and lymph vessels in their abdomen or pelvis, which can stop fluids from getting to the heart, which will lead to swelling in legs and specifically in boys, the scrotum. So it can also press on the bladder, which causes issues with urination or irregular bowel movements. Now, if the tumor is located in the chest or the neck, you may be able to detect a hard and painless lump in those areas. The tumor could also possibly be pressing on the superior vena cava, which is the large vein in your chest that returns blood from the head and the neck back to the heart. And this could cause some swelling in the face, neck, arms, and upper chest, or possibly even headaches, dizziness. And if it presses on the throat or the windpipe, it can cause coughing, and the child can have trouble breathing and swallowing. And then sometimes, but rarely, it may press on certain nerves in the neck or chest, which can cause drooping of the eyelid or small pupil, or nerves near the spine, which may affect their ability to feel or move their arms and legs. Now, if the cancer has started spreading and you didn't notice, that's okay. It's better to detect it now rather than never. So commonly, the cancer is going to spread to the lymph nodes, and these are bean-sized collections of immune cells found throughout the body. Normally, these are going to swell in the neck, above the collarbone, under the arm, or in the groin. Enlarged lymph nodes is a large indicator that you have some sort of cancer, so if you notice anything like this, please go to your pediatrician immediately, or if your child is complaining of bone pain, inability to walk due to the pain, weakness, or numbness, or even paralysis in arms or legs, the tumor could have also spread into the bones. Sometimes you will notice some bumps under the scalp if it has progressed to the bones in the skull. And if your child is frequently getting infections or having excess bruising or bleeding from small cuts or scrapes, this could be a sign that it has reached the bone marrow. So again, reach out to your immediately. All right, so the last cause of certain symptoms is actually going to be because of the neuroblastoma cells themselves, not just them invading certain areas and inhibiting those. So normal nerve cells release hormones throughout the body in order to control different body functions. For example, they can release adrenaline in order to regulate your body's reaction to stress. So neuroblastoma cells kind of act in this way as well, and it causes certain symptoms to occur. So because of the release of certain hormones from the neuroblastoma cells, you can see some constant watery diarrhea, fever, high blood pressure, rapid heartbeat, reddening of skin, and possibly even sweating. Okay, so that was just like a general overview of the symptoms that one may experience. If you guys would like more in depth to understand tumors, the structure of tumors, anything like that, more biological things that go on in your body that's supposed to be happening that isn't happening when your child has the cancer, please comment down below and let me know if you would like more information and more detailed knowledge about that. So now I just want to quickly address the parents and caregivers out there watching this video to either get more information or are just worried for their child, which is probably why you are watching this video. So you are probably all wondering, was this my fault? Did I have anything to do with this? Did I give this to my child, etc.? So the answer is no, a hard no. It is so incredibly rare for neuroblastoma to be inherited from a parent, and most neuroblastomas are the result of gene changes in neuroblasts that happen during the child's development and sometimes even before birth, and what causes these acquired gene changes is not known. And most of the time, it's literally just random events that happen within your cells without having any outside or environmental causes known. So once the child grows up all healthy and beautiful, they will not be able to pass neuroblastoma onto their offspring because it is an acquired gene mutation that does happen specifically to their cells. So they're not going to be able to pass on that gene mutation that has just happened within them, and it's not inheritable. If you are questioning whether or not you are still part of that 1 to 2% of inherited cases, you can get genetic testing done with diagnostic services or a specialized genetic counselor. So specifically, you do want to be looking at 2 specific genes. So the most common oncogene that is affected is called ALK oncogene. So you want to look specifically at that. Or for a small number of cases, the PHOX2B gene, which normally helps nerve cells mature. That is also accounted for in a small number of cases for those inherited cases. But please remember that it is still not clear what causes many of the gene and chromosome changes that lead to neuroblastoma. There are no known lifestyle-related or environmental causes of neuroblastomas, so it is very important to remember that there is nothing these children or you guys, their parents, caregivers, or whoever could have done to prevent these cancers. You guys are doing everything right so far. If you are watching this video, you are doing your research and getting more educated on this topic, and hopefully you guys have been communicating with your pediatrician or doctors about any concerns that you have been having, or if your child has already been diagnosed. So what we can focus on now is how to treat it and where we go from here. Alright, so let's get to know our fake patient. So I just want to emphasize how important it is to for the doctors to collect an accurate and detailed family history. This family history could have an impact on the treatment, on the prognosis, on how the doctor just overall looks at the patient and analyzes them. So having a very detailed and accurate medical history is very, very important when treating any patient, especially a cancer patient. So let's look at the detailed history of our patient. Her name is Lilo. They are 2 years old. Their date of birth is January 6, 2021. That is my birthday as well. What a coincidence. She is a female from Honolulu, Hawaii with no allergies. I don't know if you're seeing the connection between Lilo and Stitch here, but that is where I'm getting this character from. She was born by C-section at birth, and she has a known ALK mutation, and the symptoms that she's experiencing today are a lump on her scalp as well as swelling of her abdomen. So it is very important to note things that you don't even think are going to be relevant. Like, you will later see that the C-section at birth, it is not relevant to the treatment plan, but there are many things that you may think are not relevant but may be considered very proficient information for the doctors to use, even if you don't think so. So please be sure that you list anything, any minor things that may have happened within your family ancestry or history, medically wise, that the doctors may possibly think is more important than what you think. Alright, so first, after you bring your child to a pediatrician or doctor, they are going to assess your child based on the symptoms that they are experiencing or any precursor conditions that may have been noted in the family history, which will then determine the tests that they are going to use for your child to determine the proper diagnosis, prognosis, and treatment plan to move forward with your child. So in Lilo's case, this doctor is going to focus on the symptoms mentioned earlier that the parents were noticing in the child. So that's going to be the lump on the scalp and the swelling of the belly. So they are going to do a physical exam for those lumps and swelling in the abdomen. And examples of initial tests that may be used after they do the physical exam, if they deem necessary, is going to be some imaging testing, including abdominal ultrasound, an MRI, a CT scan, or some sort of nuclear scan like an MIB or bone scan. So in Lilo's case, the doctors will most likely go along the route of getting an abdominal ultrasound. This test uses high-energy sound waves that bounce off the abdomen and make echoes. And then these echoes are going to form a picture of the abdomen called a sonogram. However, the doctor might also note that in Lilo's history, she has an ALK mutation, and this means that she is more prone to having neuroblastoma. In this case, or any case where one is more susceptible and has one of these risk factors, and again, that includes any mutations with the ALK or the other gene, certain birth defects or syndromes, or prominent family history of neuroblastoma. In this case, Lilo is going to want to get an ALK biomarker test because she does have that gene mutation. and this will be checked in the laboratory for mutations or amplifications, meaning they're just checking the numbers of the ALK gene, and these changes may increase the growth of cancer cells. So finding changes in the ALK gene in tumor tissue may lead to changes in the cancer treatment plan. Having a urine catecholamine study may also be recommended. This is a test in which a urine sample is checked to measure the amounts of certain substances, such as vanillamandelic acid, VMA, or homovanillic acid, HVA, that are made when catecholamines break down and are released into urine. A higher than normal amount of VMA or HVA can be a sign of neuroblastoma. Now, after all this testing is done and your doctor and the lab technicians and whoever else has been analyzing and working on creating this personalized treatment plan for your child, remember this is an interdisciplinary practice, so it's not just one person, one doctor that is consulting on your patient, on your child. It is multiple doctors analyzing the results, analyzing through their specific specialized lenses in order to give their opinions and to create a successful and personalized plan for your child. So after all of them have consulted and concluded on the diagnosis, you are either going to be diagnosed, yes, with neuroblastoma, or you are going to be able to go home free and safe of cancer if the results come back negative. So coming out of receiving a diagnosis, you should know these few things. So 1, if you have it or not, and then if you don't have it, go home, relax, and just be happy that you don't have cancer. But if you do, then the following is for you. So you're going to want to know what stage your cancer is at. If it's highly aggressive, if it has progressed to and metastasized outside of its original location, that is very important to know. The prognosis. So based off of your medical history, based off of what's going on inside with the tumor and the structural things and all those biological things that I didn't get into, that's all going to determine the prognosis. And then the treatment plan, the most important part, how you are going to proceed forward with how to cure this cancer and how to beat this cancer. And then within that is going to be the monitoring that is needed within the next few months or the next few years even in order to overcome this diagnosis. In Lilo's case, she was in fact diagnosed with cancer. So, now that she has been diagnosed with neuroblastoma, the next thing that she is going to want to know is which stage this cancer is now in. Okay, so there are 4 stages of neuroblastoma. So there's L1, L2, M, and then MS. So L1 is when the cancer is only in the original location and it has not spread beyond that at all. And then L2 is when it has spread no further than the surrounding tissue. It is ideal to catch and diagnose the tumor when it's in these 2 stages because the tumor is more centralized and it is easier to cure, and in the treatment plans that you will hear later, to surgically remove, to get rid of because it is in a certain area. However, when it gets to M stage, this is when things start to get a little bit scarier because it is spreading further out than the original site of the tumor. That in turn means more inhibition of normal organs and cells trying to function normally and properly. And then the MS stage, the 4th stage, is only applicable to children who are under 18 months. And this stage is classified by the cancer spreading to the child's skin, liver, and bone marrow. So in Lilo's case, the doctors are going to find that this tumor is more aggressive. Normally, children under the age of 18 months tend to have a less aggressive neuroblastoma. So children over 18 months, such as Lilo, who is 2 years old, may develop a more aggressive cancer, which can spread beyond its original location into that M phase. Therefore, the doctors will determine that Lilo is in the M stage. All right, so something very important to also think about, and that you all may be worried about, is who exactly are you going to be interacting with? Who is dealing with all of your child's charts, all of their analysis of their labs? Who is dealing with all this stuff? And as I said before, this is an interdisciplinary practice. So there are multiple people who you are going to be interacting with, who are going to be helping to make your patient care experience the best that they can to have the best possible outcome. And that goes all the way from the receptionists at your pediatric office's desk, all the way up to the MAs, to the physicians, to the lab techs in the hospitals or in the labs where they're sending your results to get tested, to get analyzed, etc. As I mentioned before, this is an interdisciplinary practice. So something that I think is very important to think about is, how do allied health professionals work as an interprofessional team in order to properly diagnose and treat newborns born with neuroblastomas? So as we go through the rest of the treatment plan with the specific treatments that may be possible for you to be going through, I'm also going to touch on the people that you will be interacting with and the specialties and the different things that you need to also consider, while also knowing these detail-oriented things when dealing with the treatment aspect. So now, after being diagnosed and having a prognosis be established, we want to focus on the different treatment plans that may be recommended. So for most patients, as I said before, this will resolve on its own. Therefore, observation is the key. So doctors will just recommend observational treatment. They will establish routine check-ins in order to monitor any changes in symptoms that appear. And if they further, then more aggressive treatment action may need to be taken. For those that in that L1 or L2 stage where the cancer has barely spread or hasn't spread at all, surgery is also an option. Pediatric surgeons, along with the nurses, anesthesiologists, surgical technician, and more will work together in the OR to remove the tumor and any lymph nodes that can be checked for signs of cancer. If the tumor ends up not being able to be removed, then a biopsy will be done instead, where they just take a specimen of the tumor that they can use for further testing so they can revise their treatment plan. Chemotherapy or radiation therapy are two types of treatment that are used to stop the cancer cells from dividing. Chemo uses drugs that are either injected or taken by mouth, and radiation uses X-rays or other types of radiation to kill off those cells. In Lilo's case, since she is at a higher risk of having neuroblastoma, there is a 3-part treatment phase that she must follow. So there's induction, consolidation, and maintenance. So treatment during induction may include combination chemotherapy or surgery. Combination chemotherapy is basically when they use 2 or more anti-cancer drugs in order to treat the patient. Treatment during consolidation may include 2 courses of high-dose combination chemotherapy followed by stem cell rescue, and then also possibly radiation therapy. So stem cell rescue is a treatment to replace the blood-forming cells. Stem cells or immature blood cells are removed from the blood or bone marrow of the patient, and then they are frozen and stored. After the completion of chemotherapy and radiation therapy, the stored stem cells are thawed out, and then they're given back to the patient through infusion. These reinfused stem cells grow into and restore the body's blood cells. And then in Lilo's case, she is going to want to undergo a more intense form of radiation therapy. This is called external radiation therapy. This uses a machine outside of the body to send radiation towards the area of the body with cancer, and this treatment is used for patients with high-risk neuroblastoma or for patients whose tumor grew while being treated with chemotherapy. So some treatment during maintenance may include monoclonal antibody therapy, granulocyte macrophage colony stimulating factor, and isotretinoin. Some treatments that are still undergoing some clinical trial and studying are currently a clinical trial of iodine-131 MIBG therapy, targeted therapy, or a vaccine that will treat cancer. It is important to note for high-risk neuroblastoma, there is no standard treatment, so patients treated for high-risk neuroblastoma may want to consider going into a clinical trial and trying out some of these new therapies, these new medications, in order to try to help cure their cancer. If you have a patient who is at a more low risk for having neuroblastoma, then treatment normally goes as follows. So normally it's surgery followed by observation, and then observation of biopsy, chemotherapy, radiation therapy, things like that. The same follows for intermediate risk of neuroblastoma. So what is recommended is chemotherapy for children with symptoms or to shrink a tumor that cannot be removed by surgery. And then surgery can be done after chemotherapy. Observation for infants and surgery for infants, and then radiation treatment also is recommended. Okay, those are all of the treatments that mainly focused into the high-risk neuroblastoma diagnosis. If you guys would like another video explaining more in depth about each treatment separately, or more in depth about low risk, intermediate risk, or more about high risk, please let me know in the comments, and I will be happy to make another video with more in-depth information. I just want to reiterate the fact that there are so many people out there that are willing to help you. First, please go to your pediatrician, call your pediatrician's office, get an appointment, talk to the scheduler. Those are allied health professionals too. They are all in the healthcare field trying to help you out, trying to help and make your patient care experience the best it can be. You will be most likely referred to a pediatric oncologist who will be overseeing your treatment plan for the cancer after you go see your pediatrician for your initial testing. So there's so many people that you are going to have to run into, many nurses that are going to be on your case, many medical assistants, lab technicians that are in the basement that nobody really sees. They all are there to help you, even if they're not acknowledged at every moment, even though your primary contact is going to be your physician who is going to relay all the information to you. So just know that there are so many people that are working in this interdisciplinary field in order to help you and help your child receive the best care possible. Thank you so much for listening to my video and coming to learn more about how to deal with this diagnosis that is very scary to many. If you would like to learn more, please let me know. I have much knowledge and have done much research on this topic, and I have many resources that I can ask if you would have specific questions. But again, the best person to ask is your pediatrician, a pediatric oncologist, or something like that, who have more medical expertise. But if you would like to ask me any questions, I would be happy to answer, and thank you again for listening to my video.